Mother and baby will learn the art of breastfeeding with time, patience, gentle guidance, and practice. Breastfeeding is a combination of instincts and learned skills for both mother and baby, and it may take a while for breastfeeding to become familiar to both of them.
Balloons, bazookas, boobies, bosoms, boulders, cans, hooters, knockers, melons, honkers, jugs, rack, tatas, tits, torpedoes, guns, bust, doorknobs, coconuts, and our favorite one, the girls. Welcome to the All About Breastfeeding show, where your host, Lori, highlights mothers just like yourself and goes beyond the surface questions and digs deep so they share not only their joys and happiness in their daily breastfeeding life, but also their pain and struggles and how they worked through them.
FAQ Day number 1. Welcome to All About Breastfeeding, the place where the girls hang out. I am your host, Lori Jill Eisenstadt, IBCLC. This week is the beginning of Season 2 here at All About Breastfeeding. Monday was the first day of this new season, and we enjoyed a great interview with Penny Simkin. On Wednesday, I began the first of 12 shows in which I am taking you on a historical journey in infant feeding from past to present. Today, which is Friday, is the first of 12 shows in what we will be lovingly calling FAQ Day, where I will be answering some of the most common questions I am asked. I have a roster of the same questions that I get asked every day on my job. I bet this happens to you in your job. You get asked a lot of questions, but some you just get asked over and over. I have often dreamed of putting them all together in one handout to make it nice and easy for everyone. Once we're done with the 12 weeks, I'm going to put that handout together and share it with you and all my clients. It's just one of those things I just haven't had time to do. I've often said to myself, wow, what a great idea. Why didn't I think of this sooner? Oh well, as they say, better late than never. I hope you like the format for Season 2, and as always, I welcome your feedback. Just go to allaboutbreastfeeding.biz/contact. That's the place you go to send me your thoughts. I'm starting off today with the number one all-time question I am asked the most. What is an IBCLC? I'm going to start by telling you what all those letters stand for. International Board Certified Lactation Consultant. An IBCLC is a healthcare professional who specializes in the clinical management of breastfeeding. An IBCLC works in a wide variety of settings, providing leadership, advocacy, professional development, and research in the field of lactation. We have to adhere to standards of practice and a code of ethics, and work within a defined scope of practice. We must maintain our certification every 5 years by continuing education or by exam. Before sitting for the exam, candidates must demonstrate extensive clinical experience, 1,000+ hours, and advanced lactation education, at least 90 hours. IBCLCs are prepared to help with any breastfeeding issues, from basic problems to complex situations. You will find IBCLCs working in maternity units in hospitals, in the NICU and the special care nursery. We work in outpatient clinics, in WIC offices, pediatric and physicians and midwives' offices sometimes employ IBCLCs. We also have private practices where we meet with moms on an individual basis in your home or in our office. There are currently over 28,000 IBCLCs practicing in over 102 countries. We even have one day a year that we celebrate IBCLC Day, which is on the first Wednesday of March. And all this, and to think that this profession was not around 35 years ago. I was interested to learn the breakdown of IBCLCs, and I learned that there's over 15,000 IBCLCs in the United States alone. Next comes Australia with about 2,150, then Canada with about 1,800 IBCLCs, and Germany with about 1,500. I have added a link to the complete list of IBCLCs in the show notes because the numbers may have changed by the time you get to this. There are prerequisites to fulfill before taking the international exam. It is slightly different for each person depending upon when they were certified and what degrees they had before becoming an IBCLC. Common coursework needed before sitting the exam for many is some classes in biology, anatomy and physiology, nutrition, counseling, psychology, infant and child growth and development, and an introduction to research and sociology, or some cultural sensitivity courses. About the time I decided to become an IBCLC, I decided to start with the entry-level course, just so I could get a sense, is this the direction I really wanted to go in? I wanted to see if I liked it enough to devote a few years and many dollars to learning all I needed to know to become an effective IBCLC. This entry-level course was 45 hours, and there were about 20 other people in my class. Most were WIC employees who were not planning on taking their education much further. They just wanted to know enough to talk about the basics to their clients and perhaps teach a breastfeeding class. A few students were nurses who worked in postpartum labor and delivery, and they soon realized they had a passion for helping moms with breastfeeding. Each one said that they saw the need for further training as they realized the more they work with mothers and help them with breastfeeding, the more they realized that they had only learned the basics and they really wanted to know more. So the 45-hour course was entry level for them also. They wanted to learn more, and some had a goal of becoming an IBCLC. The reasons I wanted to become an IBCLC is really because the impact I felt I could make on mothers around me. As a childbirth educator and a birth doula, I was seeing so many moms who wanted to breastfeed. They started breastfeeding, but many didn't quite make it past a few weeks or first month. I tried to help them, but I often found my skills were lacking. Even then, I didn't set out to become an IBCLC all those years ago. The opportunity to become one just sort of fell in my lap, and this is a story I will save for another episode. Since its inception in 1985, you need to pass an exam that's given once a year, and it's an all-day exam. Typically, I have had to travel over an hour to the exam location. A few years ago, the organization offered some of us the opportunity to join a pilot program where they would be offering a computer-based exam at a local testing venue. I jumped at the chance, and I could not have been more pleased. I drove exactly 15 minutes to the building. Once the exam started, I had a choice. I could take breaks whenever I wanted to, or just power through without taking a break. I opted to just take it from beginning to end. Not that I was racing to get it done as fast as I could. However, I finished before noontime, whereas before, the exam was not over until at least 4 or 5 o'clock. This was because they had dedicated break times when you had to take the breaks, you had to take a long lunch, and where you also had to take that time off. You could not be in the testing room, taking the test. Needless to say, I was much happier being able to take it in my own timeline. The exam was just as intense as it has always been, but it did not really have to be a whole day affair, for me anyway. This was a huge success and an option offered to many exam takers. Thank goodness I passed, and believe it or not, it's been 5 years and I'm up for recertification again this October 2016. And I need to do that every 5 years. I just sent in all my paperwork. Do I stress when I take the exam? You bet I do. As our knowledge in the field of lactation advances, So does the testing aspect as it reflects current research. You might ask, it is just breastfeeding for goodness sake. Yeah, on that one hand, you are correct. Baby, breast, milk, boom. You put them all together, that's all you need to know. As long as things are pretty straightforward, I could easily help a mom with what I learned in the 45-hour course. Here are just some issues, though, that we come into contact with every day, and this is why I need to know so much more. The information we have about premature babies, sick babies, special needs babies, babies with midline defects such as ties and clefts, babies who have broken clavicles, hip dysplasia, torticollis, and other health issues that make breastfeeding more difficult, like heart issues, digestive issues, lung issues, or feeding and swallowing problems. Moms, some have had breast surgeries, reductions, biopsies, implants. Some moms who have had fertility issues need help. They're taking prescription medication. Maybe they have thyroid issues, diabetes, autoimmune disease, depression. They've suffered through a birth trauma. Perhaps their breast or nipple anatomy is out of the ordinary. They have medical concerns regarding low supply or oversupply or breastfeeding aversion. That is just a snippet of some of the issues that we deal with when it's not straightforward. I am always learning as each mother and each baby teach me something new. As much as I hate taking tests, I'm kind of glad this is a requirement to keeping our certification, as I know it forces me to go to conferences, attend workshops, read current books. It helps to keep me current. As an IBCLC, every day when I leave my home life to enter into the life of a family for a brief period of time, what fuels me is the positive impact that I'm able to make on each family. I know that as I work with each individual mother, I'm doing my best to help her with whatever challenges she is experiencing. For the modern mother, there are so many challenges, so many barriers that can get in the way of breastfeeding. As IBCLCs, we are trained to take every mother-baby pair and situation separately and do our best to meet their needs. We work closely with families as our goal is to increase breastfeeding rates, improve breastfeeding outcomes, and do our very best to help all those who want to breastfeed to do so in comfort and enjoy for as long as they desire to. The knowledge base that we have helps us to know when we might even need to refer to some other specialist for additional care for this mother. There are many places families can go to for breastfeeding help once discharged from the hospital, birthing center, or your birth team that leaves you after you have your home birth. All the lovely professionals who you've come to know and trust, well, the reality is they don't get to go home with you. And if you're having some problems, you can call an 800 number, a warm line. Maybe the triage nurse at your baby's doctor's office can help you. Local breastfeeding volunteer groups, entry-level breastfeeding educators. You can get some help from your neighbor, the internet, Facebook groups, videos, and books. So, why should you seek help from an IBCLC? Well, breastfeeding should be easy. Remember I talked about before, straightforward. Baby, breast, milk, boom. Straightforward, easy. It should be easy, convenient, and pain-free. However, if you are experiencing problems with breastfeeding and they cannot be solved quickly and easily with one of the mentioned sources, you really should seek help from an IBCLC because the risk of discontinuing breastfeeding gets higher each day the problem goes unresolved. Just think about this. When you have a problem that is not easily solved, you typically go to an expert in that field for help. If you have a toothache, you go to a dentist. If you're concerned about your heart, you see a cardiologist. If you have back problems that are not solved by simple stretches and exercises, you go see a massage therapist or a chiropractor. If you have a problem with dry eyes and the solution you purchase over the counter doesn't help, you go see an eye doctor. You're getting my drift, right? If you're suffering with breastfeeding challenges, getting the right help is also very time sensitive, meaning that while you are spending time trying to figure things out, your milk supply may be suffering, your pain level may be increasing, your baby might not be doing so well. This is not an area of healthcare that you want to wait too many days or weeks before seeking specialized help. I am going to be attaching links to various organizations so that you can learn more about IBCLCs, our credentialing organization, our membership organization, internationally and locally. If you would like detailed information about becoming an IBCLC, you will find enough of these links in the information I give you to get you started. See you next week on FAQ number 2, where I will share my personal reasons for becoming an IBCLC and the pathway I took to becoming an IBCLC. Until that time, I leave you with today's quote. There is no end to education. It is not that you read a book, pass an exam, and finish with education. The whole of life, from the moment you are born to the moment you die, is a process of learning. Until next week, bye-bye. Have you heard that Phoenix, Arizona is blessed with an amazing birthing center? Baby Moon Inn Birth Center is the best option for families who want access to midwifery care in and out of a hospital setting. You can experience birth in a comfortable home-like setting where natural birth is the focus. Laboring in water, being able to walk outside during labor, and enjoy the beautiful garden. This is what birth can be like for you. There is so much more to learn about Baby Moon. The staff would love to have the opportunity to meet you and would like to extend an invitation for you to attend a free Choices in Childbirth class and a tour of the birth center. All you need to do is call 602-314-7755. That's 602-314-7755 and ask for the tour dates. You can also go to allaboutbreastfeeding.biz/podcast, and on the right-hand side of the page, you will see a link that will bring you to the calendar, and you can sign up for the tour yourself. When you come in for the tour, make sure that you tell them you found out about it from the All About Breastfeeding podcast, and you will be given a very lovely free gift.